Hi, my name is Muhammed Ahmad, and today I will be discussing the important anatomical terminology. Anatomical terminology is crucial for accurately describing the location, relationships, and functions of body structures. It ensures clear communication among healthcare professionals and aids in the diagnosis and treatment of conditions by providing precise descriptions that avoid ambiguity. Anatomical terms include directional terms that denote the position of structures relative to one another. These terms include superior, inferior, anterior, and posterior. These terms help create a framework for understanding the human body and facilitate accurate communication across diverse medical fields. The most basic directional terms used in anatomy are superior, inferior, anterior, posterior, medial, lateral, proximal, and distal. Superior refers to a position above another part, such as the head being superior to the chest. Inferior, conversely, indicates a position below another part, as seen with the stomach being inferior to the heart. Anterior describes the front of the body, exemplified by the nose being anterior to the ears. Posterior indicates the back of the body, such as the spine being posterior to the sternum. Medial refers to being closer to the midline of the body, like the heart, which is medial to the lungs. Lateral indicates a position away from the midline. For example, the arms are lateral to the chest. Now we will talk about proximal and distal. Proximal indicates a point closer to the trunk or a reference point, like the elbow being proximal to the wrist, whereas distal refers to a point that is like farther from the trunk. Exemplified this an example would be the fingers being distal to the forearm. Next, we will discuss the different regional anatomy terms. So starting with axial and appendicular regions. The body can be divided into axial and appendicular regions. The axial region includes the head, neck, and trunk, while the appendicular region comprises the limbs and their attachments to the body trunk. Terminology terminology for body regions can include cranial, which is the skull, thoracic, which is the chest, abdominal, which is the stomach, and pelvic, which would be the lower trunk. Each term refers to specific anatomical areas essential for clinical practice and communication. Some common terms. Uh, Body planes are hypothetical divisions of the body. The three primary planes are sagittal, which would be dividing the body in left and right parts. Frontal plane, which would be dividing the body in front and back, and transverse. Transverse would be dividing the body into top and bottom parts. Finally, we will now discuss how these terms can be applied in the field. Understanding anatomical directional terms is very vital and important for healthcare professionals. These terms enhance clarity and patient assessments, surgical procedures, and medical documentation. This ensures precise communication among medical staffs and limits the opportunity for mistakes. For examples in the medical field and medical training, directional terms guide radiologists and technicians in interpreting medical images. Terms such as superior and inferior may help locate structures within different imaging like MRI and CT scans, and this ensures accurate diagnosis. Thank you for That's it. Thank you for listening to my presentation.